Protecting your heart with every bite. Do you know how cholesterol affects you? Well, we're going to debunk some of the myths next. Okay, watch what you eat. We hear it all the time, right? But today we're not talking about calories. This is actually Cholesterol Education Month, and so we want to help you protect your heart by debunking some common myths. So we brought the expert in to help us with that. We've got Dr. Anne-Marie Feyrer-Melk, a cardiologist at Optimal Heart Attack and Stroke Prevention Center. Thank you so much for being here.
Hi, Danielle.
So first, just to start off here, what causes high cholesterol levels?
High cholesterol is in part predetermined by what type of genotype that you have.
Okay.
So it depends a lot on what kind of genes that would manifest problems with blood fat in your arteries, and then of course the almighty fat in your diet.
Yes, we always hear that diet is a big component of that. What do you think are some of the most common myths though that people kind of come up with or think of when they think cholesterol?
Yeah, well, many times people feel like cholesterol is the main culprit in cardiovascular disease, but really there's many different facets that we have to look at. For example, in patients who have heart attacks, fully 50% of those patients have normal cholesterol levels.
Wow. Okay, yeah, because people tend to think, oh, they must have high cholesterol, but not necessarily the case.
Right.
You actually brought a model here of the human heart. Can you kind of walk us through how does high cholesterol actually affect your heart health?
Sure. If I took this artery on the human heart and cut it open like this, it would look something like this on the heart model. And what cholesterol does is it helps to lay down plaque, that nasty plaque that can grow up inside the arteries and work to obstruct the blood flow and to produce heart attacks and strokes.
Yeah, so there's several health risks that come along with high cholesterol.
Absolutely. It's a blood vessel disease.
What are some ways that people can kind of maximize their heart health and try to keep their cholesterol levels down?
Right. I mean, first of all, get your cholesterol checked.
Yeah.
Especially, starting at age 20.
I was going to say, is there an age range? Because some younger adults might think, oh, I don't have to worry about that. That's a ways off.
Well, actually, children are being checked now at age 2.
Wow, really?
And then if you have risk factors, even as a young adult, to start checking at age 20.
Okay.
And normally we'll say to check your cholesterol once a year. If it's normal, that's fine. But if it's abnormal, it's time to kick it into action and then check it quarterly while you're making the appropriate changes until you get that cholesterol normalized.
Now, how easy is it for someone out there to get their cholesterol checked? Do they just call their doctor and ask, for a blood test?
Yes, I mean, most primary care physicians will definitely be following the cholesterol levels, or else you can go ahead and take the bull by the horns, get your head out of the sand, and go ahead and have it checked at one of the local labs, even for a small fee.
Yeah, it seems like the key would be just kind of motivating people to be aware of their own cholesterol levels, just to know about it, not put it off. Do you find that's often the case?
Many times it is that way. And the other important part about cholesterol testing is now we have advanced cholesterol testing, and this is looking at the particle sizes and the particle numbers that are inside the blood vessels. So we're getting really good at being able to assess someone's blood fat levels.
Wow, that's amazing that all the advances that are being made can only help. So thank you so much, Dr. Feyrer-Melk, for coming in and highlighting this important issue. And you mentioned foods as something that people might want to watch out for. So we've actually got a list here of some low cholesterol foods. So this can consist of more than grilled chicken and brown rice. 10 pretty rich foods that are actually decent for your cholesterol count. You've got avocado, salmon, pasta sauce, burritos, refried beans, curry, peanut butter, muffins, dark chocolate, and wine. Of course, I always like to put the asterisk, probably everything in moderation, right?
That's right. For women, it's 1 alcoholic beverage per day. For men, it's 1 to 2 all comers.
All right, there you go. Thank you so much once again.
You're welcome.